With the sheer scope of all that we have to juggle and cope with, it's no wonder that modern life causes us stress, and most of us rush through our days in a swirl of emotions and anxiety. So, stress is a natural reaction to the specific demands that life makes on us. But ongoing stress, as we all know, can affect a person's health in many, many ways. So, stress management is a vital life skill that can help you deal with stress in a healthy way and not let it affect your life and health. Stress management is a much floated term, but is easier said than done. So, to help you to live a life where stress is managed effectively, we present today a very, very special session on harmonizing an approach to stress management, presented by Dr. Roshan Jain from Apollo Hospitals, Bangalore. Dr. Roshan Jain is an eminent UK qualified mental health specialist and has been a professor of psychiatry with over 25 years of extensive experience in general psychiatry, addictions, psychotherapy, teaching, and motivational work and seminars, and many more. And he continues to work very actively in India and the United Kingdom. He has worked tirelessly in reducing the prejudice and stigma that is associated with mental health problems through speaking events, mental health awareness seminars, workshops, live TV and radio shows, and numerous publications. He has over 100 mental health awareness and educational articles to his credit. He is also a professor of psychiatry at the International Medical School, Management and Science University of the Malaysian Medical Council. Dr. Roshan Jain is a well-known member of many prestigious organizations, including the General Medical Council, United Kingdom, and the Medical Council of India. Thank you so much, Dr. Jain, for joining us today. It's been a pleasure to have you here to address our questions. So we will begin with some basic facts about stress management. So can you set the stage by defining this much wanted, which is stress, for a lay audience and how it impacts the brain and the body?
Thank you for a very, very nice introduction, and thank you for organizing this very, very important topic, stress management. And I think it's in the corporate world, not just in corporate India, stress is all too commonly discussed about. I think most of us are very well aware of what stress is and how to manage it, but we tend to forget very quickly. And we get on with our lives without actually giving attention to what is required to be done. And right at the beginning, as you quite rightly said, stress is a very normal physical and psychological reactions to demands of life. So there is no specific definitions for stress. The father of stress research, called Hans Selye, so in the 1930s, defined stress as a non-specific response to demands for life. And he had done a lot of research on animals, especially rats, and subjected them to stresses and irritations, and realized that there was enormous changes that happened in animals' body, in their hormone levels, in their health conditions. And he said that those changes could be extrapolated to human beings. Similarly, when we are subjected to demands, then there's a lot of changes and wear and tear that happens to us. In fact, when he did a lot of research, he said that the only person without stress is a dead person. And he spoke very much about it, and he said that stress is like relativity, is a scientific concept where people know a lot about it but understand very little. So despite all the understanding of stress, we still continue to have these problems. I think stress, as you mentioned briefly earlier, is a mismatch and an imbalance, and a mismatch between demands placed upon us and our ability to cope with those demands. Or it could also be perceived as an imbalance between expectations and our ability to meet those expectations. So when there is a mismatch and imbalance, we experience stress. And stress, again, it's a reaction of a body and mind to allow us to continue. Some stress is good, is required to enhance motivation, concentration, focus, and organization. So when we are, when there is a deadline and demand, we tend to function more efficiently and effectively. But relentless stress will bring about changes. For example, in our hormone levels in the body, in adrenaline level, in anti-stress hormone like cortisol levels, which then starts to damage our body, our vasculature, our BP goes up. It starts to cause damage on cholesterol levels, on heart, and so on. So it has a lot of negative consequences, the relentless and continuous stress. So can we say that we can be without stress? No. We need to be recognizing stress to a point where we can do something about it by tweaking, by managing the stress levels so that it doesn't have negative impact on our health.
Coming to specifically corporate workplaces, what is the stress much more these days? Or, I know people have been working over generations. There are lots of people who have, it's not that it's just that now that people are working some. But do you think that stress these days has exponentially increased as compared to the past?
I think certainly the studies suggest that the stress levels in the corporate world and in the world in general has exponentially risen over the last couple of decades. And perhaps not just the awareness of stress, but also the amount of stress, the demands of the excessive workloads, the long working hours, the working across borders, across international countries, working across time zones, working to meet deadlines, working to keep up, to keep pace, to compete, to do better, has all contributed to an enormous rise in stress levels. A lot of studies have been done in India and across. So, for example, International Labour Organization, ILO, did a big study which suggested that 50% of the lost to working days across the world is stress related. In India itself, we identified that 50% of people working in the India Inc. or techies have significant levels of stress. Over 30% of these people would go on to have psychiatric disorders, identifiable, diagnosable psychiatric disorders. ASSOCHAM also did studies which suggested that the higher you go, the more the stress level. For example, one of the studies, they said that 66% of the CEOs were experiencing high levels of stress. So higher you rise, the more price you pay on your stress levels, on your demands, and so on. If you look at studies from the American Institute of Stress in US, in UK, they've suggested that between 40 and 50% of people are experiencing significant amount of stress. Some studies have suggested that people identify stress as the number one lifestyle risk factor. Even in India, they recommended that stress is the risk factor which is over and above obesity and inactivity. So sometimes we say stress might be the new smoking, causing much more and ongoing damage than smoking ever did to us. So a lot of studies are there. There's a lot of data is there to identify, and perhaps some of that data has led to development of in-house resilience-based employee assistance program, which we'll talk about later on. But we know enough about stress. We need to do more. And as our stress level rises, our ability to cope has to rise as well. We have to be proportionately more able to be able to deal with our demands placed upon us. And the proportionate increase should be the ability to cope with them from a point of view of mind and from body.
So that brings us to perhaps the most important question in this session. How do we do it? So we know that stress has risen, and we need to somehow cope with it without affecting us too much and get on with life. So what would you particularly suggest as stress management techniques, especially in relation to the workplace?
Yeah, I think the modern concept of stress management is very, very reactive. In fact, when I do talks on stress management, I usually try to avoid the word stress management. On some talks, I've called it life management, because if stress is an inevitable part of a life, then we have to learn to manage the life itself. But in many talks, I've called it harmonization or harmonizing. which is not a novel concept. It is not a new concept, but it is a holistic approach to stress management. Uh, in our rich cultural and spiritual tradition in India, we have always talked about harmonizing, getting the inner balance, getting inner peace, getting the balance between body and mind. Uh, and through all our traditions and spirituality, we've always talked about harmonizing to get the balance. In simplest word, I would say harmonizing is like fine tuning. It's like tuning a musical instrument. So if anybody is playing musical instrument, you'll know that every time you lift up the guitar to play it, you have to tune it first. You never play the guitar without tuning it, because it loses tune after some time. If you leave it lying for some time, it loses tune. So you have to tune it to the right so that music comes out of it. If it's too tight, then the string snaps. And if it's too loose, then the music becomes shrill. The notes are shrill. So it have to have a right tension in order to get music out of it. Likewise, if you look at an old radio that I talk about all the time, where a modern radio auto tunes with the press of a button. In fact, we don't even need to, it auto searches the stations. But in the old radio, if you remember, Srinidhi, we first had to find the station, and then we have to find the tone where the sound becomes clear. So it took a lot of tuning to get the right note or right sound out of the radio. Our lives have become like that. We have to tune it every morning. We have to start off in a way that we harmonize. We start off the day in such a way that we are ready for another day ahead of us. We are well tuned and we are ready to bring music out of us rather than bring noise out of us. So the stress management doesn't have a simple technique or is set ideas and agendas under it to say, if I do this, I become that. You have to look at stress management in various facets. And perhaps if you have time, are we going to straight away talk about management techniques, or are we addressing other issues first? Or shall I go on to look at the harmonizing strategy?
I think we can finish this and then we can go on to all the attendant effects of stress.
So continuing on harmonizing, I would say that the underlying core facets of harmonizing is to understand the link between the body and mind and the soul. And what is required in harmonizing is to get a rhythm between these three things: the mind, the body, and the soul. And of course, the mind-body connection is now well established. And we always thought that they were separate. But from the scientific point of view, from psychosomatic medicine, from psychoneuroimmunology research studies, we know that the mind and body are eternally linked. And the negative impact on one has negative impact on the other. For example, if somebody is experiencing chronic stress and anxiety and depression, then you see a lot of changes in their immune system. You see a lot of changes in their blood pressure. You see a lot of changes in their glucose tolerance. The sugar level goes high, then cholesterol goes high. And likewise, somebody who's got chronic pain and illnesses, they tend to have a lot of anxiety, depression, and insomnia. So mind and body are linked. Scientific research proved that. So all the health services now are focusing on the two connections. So you say, okay, you cannot treat the body and ignore the mind. You cannot treat the patient and ignore how they feel about it. You cannot, treat an illness and not understand the emotional and psychological impact of that illness on individuals and the family. So with understanding of the mind-body connection, our approaches have now become more holistic. And although we talk about holistic approaches, we are not completely focused on the mind yet, as we were discussing earlier. We're still body focused. If it's visible, we manage it. It has to be known to us. It has to be seen to us. Problems of the mind are not visible easily. And that's what causes a lot of stigma and hesitation of bringing out. Also, problems of the mind are linked with, for example, weakness. For example, something that you brought upon yourself. Therefore, people hesitate to talk about the mind. They talk much more easily about the body. But in the healthcare, we have a big opportunity to address both together so that the recovery is complete, not just of the body, from also of the mind. So the core is mind-body connections. So how do you deal with the mind-body connections? You have to look at the mind itself. and look at mindful practices, or mindful presence through meditation, through relaxation, to deep breathing techniques, where you become more aware of your emotions, of your feelings, of your thought processes, but you also become more aware of your body and the problems within the body. So you need to do meditative practices where one can address the emotional responses to a problem. You need to look at emotional aspects or emotional intelligence, which is also one of the core aspects of harmonizing. So sometimes we call it spirituality, sometimes we call it emotional intelligence, but they're both same terms in my opinion. Being aware of your emotions simply means you're spiritual. Being aware of your emotions, of your feelings, of your thought processes, how it affects you, how it affects the other person and the larger world around us, is emotional intelligence. And one can cultivate emotional intelligence by becoming aware of themselves, by doing inward practices, by meditation and so on. So that looks at mind, mindful presence and emotional intelligence. We can also look at the body itself by being very consistent with physical practices, with activity, with exercise, uh, to nurture the body, to make the body fitter. We need to nourish the body with good nourishment, and also ensure that we have adequate amount of sleep. There's a saying that if the body is rested, well nourished and energized, then we are ready for another onslaught. uh, a healthy body gives you buffer against the day-to-day onslaught, day-to-day stresses and demands upon ourselves. And that is one of the other aspects of physical well-being, is also a part of harmonization. uh, and we need to look at our mind and body. We need to look at the harmony, our relationship, how to harmonize. And harmonizing with people essentially includes meeting, having open communications, of interactions, of developing social networks and support networks, because that is going to be the core key aspect in the way we manage our lives, in the way we manage our personal. Harmony of relationships was clearly and realized during the COVID time. When we were cut off from people, we realized the importance of social support and social network. When we were cut off, we felt that we couldn't manage times alone. And when we were just falling apart. Uh, and then finally, we need to have spiritual development. We need to become more inward. We need to recognize our body, uh, uh, the stress which we experience gives us a signal to ourselves with body aches and with sleep disturbances, with irritability. We need to be able to recognize that. Once we realize and recognize, then we will be able to manage problems. So harmonizing is looking at mind, looking at spiritual growth and development, and being aware of all these factors, so that fine tune, so that we can make ourselves ready on a daily, on a weekly, on a monthly basis.
What one notices is that, when people are stressed, they normally look towards all the things that can actually make the whole thing worse. For example, like taking refuge in alcohol or smoking or stress eating or dependence on substances. A lot of things that people think that they're doing to, because they're stressed out is actually more harmful in the long run. So how do people get out of these, bad coping strategies and then look to these more mindful and harmonizing techniques?
You quite rightly picked up. There are adaptive strategies and there are maladaptive or bad coping strategies. And I think we humans have a natural tendency to go for strategies which are easier and shortcut, quick fix. So it's much easier to improve your sleep with a sleeping tablet and get hooked onto it than to actually make effort to sleep better. To to be able to sleep well, we have to do a number of things through the day, number of things through the evening and night to be able to sleep restfully. But popping a sleeping tablet is much easier. So we are driven to doing something that is quick and shortcut. Drinking, for example, is a mad adaptive strategies. It's never meant to be a substance to calm us down, to help us sleep and so on. It's meant to be a celebrative substance, consumed in a very small amount, consumed very occasionally. If you're going to do to manage your emotional problems, stress and anxiety and insomnia, you're almost certainly going to get hooked onto it. So many a times I tell in my practice that people are driven to things which are easy. People are find it harder. So bad habits comes to us quite easily. You don't need to develop it. They develop on their own. Good habits has to be developed. It takes a lot of effort to develop an adaptive strategies to say that I'm tired, therefore I will meditate. I'm exhausted, therefore I'll go for a run. I'm feeling stressed out, therefore I'll take a break. I'm feeling this and that, therefore I'll do this and that. It's harder to do things which are adaptive and helpful. It's easier to do things which are unhelpful. We need to choose. And at the very beginning, you said that it's about a proactive choice. Our life is only as good as we choose and as good as we live it.
So we were talking about sleep. You mentioned that quite a bit, and that is another casualty in today's life, that people have lost control of good sleep hygiene and a lot of insomnia. So is that also just because of stress, or is there or does it actually feed the stress? And what could you give us, I mean, like a few tips on how people can attempt good sleep management?
I think about 90% of people I see would have significant sleep problems. And most of them don't have psychiatric disorder. You have to understand that. They just cannot sleep. And most of us, when we could sleep, we didn't sleep. When we want to sleep, we're not able to sleep. And that's become a main human problem. And sleep deprivation is a big health hazard. And Amnesty International itself says that sleep deprivation is a form of self-harm, where one is bringing it about upon themselves. I'm reminded by something that Osho had said once, to say that the world is changed so much so that at one point, we could put our head on the pillow and go to sleep. We could close our eyes and go into meditation. In the modern world, we can neither sleep in a bed, even in a quiet environment, nor can we meditate. So we've lost both these inherent abilities in us, or sleep and meditation. So this has become a big problem. To me, there is a lot of information out on sleep hygiene, as we call it. That's a concept where you structure your sleep routine in such a way that you're geared up to having a good night's sleep. This whole old concept of unwinding, relaxing, and retiring and going to bed is somewhat seems old at the moment. But people are no longer doing that. People are continuously active on their phones and devices, on televisions, and then they shut the television, close their eyes, and expect to sleep. It's not going to happen. An overactive mind is opposite of sleep. We need to be relaxed. I think, to put it simply, we need to ritualize sleep. Just like we ritualize prayers, we just don't pray anywhere. We have to have a bath. We have to wear certain clothes in certain way. They have to be fresh. And then you sit down and pray in certain place, in certain environment. Sleep has to be dealt with as though it is like a prayer. It's like a meditative practice, where you need to completely ritualize your evenings, unwind, relax, get refreshed, avoid all stimulations, avoid all distractions from small, medium to large screens, avoid coffee, tea, nicotine, avoid everything that can disrupt and disturb your mind and your body. Avoid everything that will make you restless and impatient. And create an ambience which is quiet, pleasant, perhaps a soft music, and then go to bed. The important thing is to sleep on the same time, if possible, on a daily basis. Of course, on the weekends and during our hectic work schedules, we can't sleep, but most of the other times, sleep and wake at the same time. Sometimes we sleep late, but make sure that you control the waking time. Always wake up at the same time, because when you sleep late and wake up, the following day, the body will demand for sleep. So sleep, wake at the same time, but wake up at the same time always, and get some activity, get some exercise, get some sunlight through the day. For many, Srinidhi, I think it's very, very important to understand that this is a time and age where we have to earn our sleep. Just like we earn our bread, just like we earn our relationships, we have to work for it. We have to earn our sleep. It is just not going to come to us. So we have to work hard to get a good night's sleep. And if you are ignoring it, then you're going to be punished very, very heavily for it.
Right. So coming back to the workplace, yes, we know that, everybody faces tremendous work pressures these days, but there are certain specific circumstances where things get even more challenging. So, for example, if there is an interpersonal issue where, there is sometimes hierarchical issues, or there is toxic behavior, or there is bullying, or there is inordinate pressure. So there are lots of things that can go wrong at the workplace. So I want to ask you, in these kind of circumstances, what would be the top tips for coping with such pressures, such extraordinary situations?
There's
It
an
might
old
also a certain amount of depression that you were passed over for your promotion, or specific circumstances like that.
So very specific demands at workplace. How do you manage with that? That's the.
Yeah.
There's an old saying which says in UK we used to always say that, I love my job. It's the work that I hate. And you need to start not just loving the work like you love your job, but not like your work. I think you need to start liking your work, and you need to start by making the workplace a more enjoyable place to be. Sometimes we say that if you feel at home at workplace, then you're absolutely in the right arena, and you're going to do well and thrive in that area. So try to make yourself at home in your workplace. And how do you do that? I think the most important factor amongst all the top reasons for people experiencing workplace stress, workload, long working hours, tight deadlines, high levels of expectations, role changes, as we call it in the corporate world, constant disruption, constant changes. By the time you catch up, it is already changed, especially in the technology world. So, is that going to stop? No. Our workplace, our world is in a constant state of flux. It is going to keep changing. To do that, we have to be resilient, we have to be ready, and we have to be able to manage that. But can we do this alone? No, we need people. And at workplace, you got colleagues and peers. So the number one advice I would give to people at workplace is to improve communication and interaction with your colleagues. Because as I mentioned earlier, I think communication is one of the principal factors in improving relationships. And of course, there are other facets or pillars of improved relationship to people. I always say is the communication, the trust, respect, and love. So CTRL, just like the computer key. So communication is number one pillar of relationship. So if you have an effective, timely, clear communication with your colleagues, with your peers, with your managers, then you're going to be better able to do your job at work, no matter how much the workload is. You need to be able to express your concern and expectations. You need to be able to discuss what things you are able to do and can't do. For that, you require to have effective, clear, and transparent communication with your managers and peers, but also with your colleagues. Because when you communicate well, you have good relationships. And when you have good relationships, then you have the support and network, which will either buffer you against the stress and demand, or will help you to work through and cruise through difficulties. So I think having a good communication is very important, because communication will also then lead to cooperation and cohesion at workplace. And that has become increasingly difficult. So instead of cooperation, there is competition at workplace. And instead of cohesion, there is limited interaction. People don't want to talk to each other. People cut off from each other. And increasingly now, when people are working from home, then you have none of this. The elements of cooperation and cohesion has minimized significantly. And the network and the ability to socialize and develop social skills has also come down. So communication, cooperation, and cohesion would be the first thing to be able to manage your workload and work pressure and demands. Because things outside of you are not going to change, but things within you and how you deal with people that you work with is going to change. So that probably will be the main factors. But when you're managing everything else, I think you need to manage yourself. The self-care is very, very important, because think of it that way. If I'm helpful, if I'm healthy, then I'm helpful. If I'm healthy, then I'm productive. In the corporate sense, they say, employee health equals productivity and and output and so on. So the employee needs to prioritize their self-care. You need to give priority to your own health. You need to take regular breaks at work, regular breaks from work, and also you need to uh, try to balance the work in such a way that you're able to decide when the work starts and finishes and when your life starts. So work-life balance would be the third one, which is very, very commonly discussed. Uh, so when you're able to communicate betterly, when you're able to self-care, when you have a good work-life balance, then you understand the value of time and time management. Uh, which brings us to the next concept, where you need to, time management is all about prioritizing, is about identifying the workload, is about breaking the work into small chunks, into manageable chunks, uh, and doing what is necessary immediately, and so on. So these are some of the common things that we need to do. We all know about it, but I think we need to be consistent at it, uh, with all these things. Doing all these facets in a consistent manner will help you to manage work stress.
I think we will have time for just a couple of questions. So one thing that I wanted to ask is women as I feel women probably have tougher time because they, whatever we may say, still women do have the brunt of responsibilities at home as well, both family, kids, exams. So it's most of the time the mother who has to take a larger role in that. As women are now taking up larger and more powerful positions and are working, most of them are working now full time. What would be specific tips on for them to manage, because work-life balance is not just switching off and then relaxing for them, probably means a whole set of new responsibilities that start once work time gets over.
Yeah. And you're quite right. In fact, work-life balance, the concept itself was addressed in concept of women more than men, where they have to juggle or multitask between the ever expected responsibilities of being a mother, caring for the home, and raising the children, and doing all the things that are required, plus the office work. So the demands upon women is much more, I think, than men, because men can walk away from various aspects of their other chores and responsibilities. Women cannot. Women will not. Men will walk away. Women will not walk away. So because of the motherly nature and so on, they will try to juggle both. And I think women are better able to juggle between multiple roles and tasks much better than men. They're more emotive. They are more emotionally aware. They talk about their emotions much more than men. So I think women needs to, when we talk about the work-life balance itself, they need to be not about switching off, but drawing a distinction between the two. When you're at work, you stay at work. When you're at home, then you draw a distinction between where you need to end the work. If you're going to carry work over, and if it's going to spill over into your home life, then it's going to be difficult. Uh, in the Indian context, I think the work-life balance can be managed by outsourcing. Just like in the IT world, people outsource to from foreign countries to Indian countries because they want some of the work being done by somebody else. We need to outsource our responsibilities to other people. Getting domestic help, getting childminder, getting people to do things for you is not that difficult in India compared to outside of India. So you need to get some of the things done by other people. For example, as a senior consultant, I can't be doing everything in the department itself, on the ward, and outside. I need to have multiple layers under me to be able to do. They do some of the basic things, and I do some of the bigger things. Like in corporate world, either you do the day-to-day chore, or you go into strategy and thinking. So you can't do both. So as you rise the rank, You need to have layers under you who can do things for other people. So women need to be more aware how the life is spilling into work and how the work is spilling into life. Outsource, get help, get support. And of course, the support also should come from the partners. And I think we are now only beginning to learn that a household needs to be managed by man, woman, and man, not just the woman. No, although we have been patriarchal in places like Rajasthan, for example, where I come from, the household was always matriarchal. The woman was the head of the household, and they were all powerful. So men, women now I think needs to take equal responsibility. When we do counseling for people, often is because of this work-life imbalance. The husband or is not fully participating in domestic chores, childcare, and other responsibilities. So that balance also needs to come. So work-life balance and the balance between couples and husband, wife, boyfriend, girlfriend, and so on.
Is there anything else, Doctor, that you would like to add in this session?
Well, I'm quite happy to take any questions if people have put in any questions, but
I can't see any at the moment. But I have one more question for you. One term that people often talk about is burnout. So, is there something called a burnout? Are there any particular signs that one must be aware of? And is there something special that one must do if there is an extreme amount of work stress and there is complete, one is paralyzed from doing anything? What would be the warning signs?
So I think burnout is a concept that is somewhere in between stress and illness. So when one is experiencing stress, we overcome it by slowing down and doing things. But when stress becomes relentless and it doesn't wear down despite doing things, then one leads to burnout. And burnout is one step before you become ill and have a complete breakdown, becoming anxious, depressed, having high blood pressure, having diabetes, and so on. So burnout is very similar to stress, but a severe version of that, where the person can have physical to psychological to social symptoms. And the physical symptoms would be they'll feel restless, they'll feel edgy, they will feel impatient, they will feel anxious, they can have palpitations, they can have sweaty, they can feel ill at ease. Psychologically, they'll become cynical, they'll become negative, they become irritable, have anger outbursts. So you're wearing out, psychologically. You can become anxious, you can become depressed, you can have sleep disturbances. And then there are behavioral facets to burnout where you lose interest and motivation in things that were previously enjoyable. You start to feel tired and exhausted more easily. You lose interest very, very easily. You drift. You lose hope. You don't want to do anything that you do anymore. Although you are happy being who you are, but you still just do not like to turn up and do things that are expected of you. So you're burning out, just as the word itself, physically, psychologically, behaviorally, and socially. And social burnout simply means that you start to withdraw, you isolate, you cut off. You don't want to be around people. You want to be alone. But when you're alone, you don't feel well. You feel ill. So these are the facets of burnout. To understand simply, it is somewhere in between relentless stress, which leads to burnout, and then burnout leads to breakdown and illness. And those illness can be physical or psychological illness, which is a long-term consequence of stress.
So it's important to seek help if any of these symptoms are manifest.
I think so, absolutely. And it is important to the principles of stress management is to recognize and admit that after all, we are human beings, that there's only so much we can do in a day, that we are okay to get tired and stressed out. We are okay to get fed up. We are okay to be unhappy with what's happening. We are okay to make mistakes, but importantly, to learn from the mistakes, to recognize and admit that we can get stressed, that we are human beings, but to understand that we need to do something about it. So in the first instance, most of us would say that look for the early signs of stress, which I talked about, the physical, the psychological, social, and behavioral features of stress. The body and the mind is giving us signals to say that it's getting too much. You need to slow down. You need to step back. You need to zoom out. You need to take a break. When that is happening, then that's what you need to do. Step back, zoom out, and take a break. At work, take a break regularly. Take break from work. We have the weekends, but we need to take holidays so that we can go back, go away, rest, relax, rejuvenate, recover, and return in a way that we can work with renewed rigor and enthusiasm. And of course, when you've gone away and still don't feel better, then you need to seek help to say whether the stress had turned into burnout and has the burnout becoming illness. So early intervention is always helpful because we might know ourselves a lot, but sometimes we need to hear it from somebody else. So seek help to talk about things, help to say whether what intervention, what more needs to be done. And sometimes we need medicines to quickly calm down. We need medicines to help you, chemically induce sleep just for a short duration will help you to rest and recover and rejuvenate faster. So seeking help is good. And I wanted to add one of the things earlier. Richard Carlson was a psychotherapist. He had said that stress is nothing but a socially acceptable form of mental illness. And it's all easy to tell somebody that I'm stressed rather than say that I'm depressed and anxious or and so on. So for many who seek consultation, they are not feeling well, but they use the word stress. So seeking help for stress might be just a beginning of recognizing if there is a big problem that needs to be dealt with, but also recognizing the need for change and need for transformation, need to learn from what is happening, what is causing the problems, and how you're going to deal with this better in the future. So at the core of it, it is about learning, growth, transformation, and equipping yourself in such a way that you're more resilient in body and mind to handle the onslaught.
Thank you so much, Dr. Jain, for this really illuminating and eye-opening session. Dear viewers, I do hope that you found this session on harmonization as a tool for stress management helpful. A well-known quote on stress management goes like this: the greatest weapon against stress is our ability to choose one thought over another. So make that choice towards positivity, use the insights that Dr. Jain has given us today, and live your best life. See you next time. Namaste.
Thank you so much.
Thank you.